Thank you. I agree with you that the testimony delivered by myself and other panelists today for the Legislative Black Caucus's committee convened on teen violence was very well received. What I attempted to do was position teen violence similar to other types of overall violence within communities as a public health issue. Previously, violence has always been looked at from a law enforcement context, and that's because that's what the citizens cry for when there are outbreaks of violence. Citizens want to know that there is prompt response to violence and that the deterrents to future violence are significant and that those who commit these acts are prosecuted appropriately. And I agree with all of those things. What I'm suggesting, however, is that if we want to focus on violence in a more effective way, we have to apply a public health model to violence. That's a model that's been applied to other public health challenges, and believe you me, violence, teen violence, overall violence within communities is a public health issue with far-reaching health consequences, both social, economic challenges, which all ultimately affect the health of our community in broad and far-reaching ways. And until we do this, we'll have some challenges. What the public health model does is it introduces a scientific paradigm for evaluating a problem that affects different types of communities, defining the problem, creating a scientific model of analysis for the problem, generating solutions that use multiple entities, including non-medical entities, business, education, social organizations, grassroots organizations, and in this way it's very collaborative to address far-reaching problems, much more collaborative and much more effective than just a punitive law enforcement program. So I think that's critical. I think the members of the Legislative Black Caucus understand how this public health model can be applied to community violence.